Today, we're diving into the 7 warning signs of colorectal cancer that you should never ignore, because catching it early can save your life and protect the well-being you've worked so hard to build over the years. Picture this. You're 35 or older, in the prime of life, juggling family, career, and health, when suddenly you notice something off in your body that could change everything. Stick around until the end to learn how to take action and safeguard your health in simple, effective ways. According to the World Health Organization, colorectal cancer is the third most common cancer worldwide, accounting for about 10% of all cancer cases and ranking as the second leading cause of cancer-related deaths, with over 1.9 million new cases diagnosed each year. In this video, we'll explore these 7 warning signs, their impact on daily life, especially after age 35, and how early detection can make all the difference, plus practical tips for prevention. Here at Health Cardio, we always bring you content grounded in public research and scientific studies from trusted organizations like the World Health Organization, the American Cancer Society, and the Centers for Disease Control and Prevention. Keep in mind, though, that this information is educational and not a substitute for professional medical advice. If you notice any symptoms or feel unwell, see a doctor right away for a personalized evaluation. Let's get straight to it. The first warning sign is a change in bowel habits, such as persistent diarrhea, constipation, or alternating between the two for more than a few days. Studies from the American Cancer Society show this happens because a tumor can block or irritate the colon, disrupting normal function. For someone over 35, this can interfere with a busy daily routine, causing constant discomfort at work or with family, and ignoring it could delay diagnosis in early stages when treatment is simpler. The second sign is blood in your stool or rectal bleeding, which may appear as red or dark stools. According to medical reports from the Mayo Clinic, this is one of the most common indicators, present in up to 50% of early cases, caused by lesions in the intestinal lining from the tumor. Think about how this affects a mature adult's routine, the fear and emotional toll of seeing something alarming in the bathroom daily. Real-world case studies, like those documented in WHO medical journals, show that patients who ignored this symptom for months ended up with more advanced diagnosis, impacting their quality of life and family responsibilities. Third, there's persistent abdominal pain or discomfort, like cramps or bloating that doesn't go away. Research from the National Cancer Institute indicates this occurs due to inflammation or pressure from the tumor in the abdomen. For adults over 35, this can be mistaken for stress or common digestive issues tied to aging, but it's actually a serious signal that could progress to chronic pain, limiting physical and social activities essential for well-being at this stage of life. The fourth symptom is the feeling that your bowel doesn't fully empty after a bathroom visit, a recurring discomfort that leaves you feeling bloated. The American Cancer Society explains this is caused by partial obstruction from abnormal growth. In clinical case studies, like those analyzed in medical journals, patients reported how this affected their confidence and daily routine, especially during travel or social events, making life after 35 more stressful than it needs to be. Fifth, stools that are narrower than usual, like ribbon-shaped, are another red flag. This happens when a tumor compresses the colon, as outlined in Mayo Clinic guidelines. For people over 35 who often deal with irregular diets due to a hectic lifestyle, ignoring this can lead to nutritional complications and accumulated fatigue, draining the energy needed to balance work and leisure. Sixth, unexplained weight loss without changes in diet or exercise is a classic sign. The World Health Organization highlights in its reports that the body burns more energy fighting the tumor, leading to this loss. In real patient cases studied in medical publications, like a 40-year-old man who lost 22 pounds in months for no apparent reason, this resulted in weakness that affected his job performance and ability to care for his kids, underscoring why you shouldn't brush this off in midlife. Finally, the seventh symptom is persistent fatigue or weakness, often linked to anemia from internal blood loss. American Cancer Society studies show that low red blood cell counts cause this. And for people over 35 already managing intense daily demands, this exhaustion can be devastating, reducing vitality and increasing the risk of depression if left unchecked. Case reports from the National Cancer Institute show that early detection quickly reversed these effects. Now that you know these 7 symptoms, let's talk about prevention and action, based on scientific evidence to protect your health after 35. First, get regular screening tests, like a colonoscopy, recommended by the CDC starting at age 45, or earlier if you have a family history. Studies show this can reduce the risk of death by up to 60%, catching precancerous polyps early and keeping your energy for an active life. Second, adopt a diet rich in fiber, fruits, and vegetables per WHO guidelines, which can lower risk by 20–30%. Picture a 8-year-old woman from a case study who improved her digestion and vitality by adding more daily salads, avoiding constipation common at this age. Third, aim for at least 150 minutes of moderate exercise per week, like walking, which the American Cancer Society links to a 24% reduced risk, benefiting both your heart and colon for a stronger, fatigue-free midlife. Fourth, avoid smoking, as smokers have a 20% higher risk of developing this cancer per the NCI. Quitting, as many patients reported in studies, improves circulation and breathing, boosting overall quality of life. Fifth, limit alcohol to no more than 1 drink per day, based on WHO evidence linking excess alcohol to higher risk. This protects your liver and colon, helping maintain weight and energy for family and hobbies. Sixth, maintain a healthy weight through balanced habits, as obesity increases risk by 30%, according to the CDC. Gradual weight loss, as seen in study examples, relieves abdominal pressure and prevents early symptoms. And seventh, if you have a family history, talk to your doctor about options like low-dose aspirin, supported by NCI research showing a 20–30% reduced risk of polyps. Always remember, if you notice any symptoms or feel off, see a doctor immediately for a thorough evaluation. Early detection saves lives and keeps you active and happy. If you found this video helpful, give it a thumbs up, share it with friends over 35 who need to know this, and in the comments, let me know. Have you noticed any of these symptoms? Or do you have a family history? Where are you from? Don't forget to subscribe to the Health Cardio channel and hit the notification bell to get more content like this about health and wellness. Take care and see you in the next video.